Namaste, greetings and good morning to everybody from CCRYN. I welcome all of you to the third day of the International Day of Yoga webinar series. And today's topic is on yoga for heart health. So we have a lot of stalwarts with us, right from Dr. Prabhakaran sir, who has published recently a very nice paper in American Journal of Cardiology on his role of yoga interventions in improving quality of life in heart disease patients. We have Dr. Mohanan sir, who is the president of the Cardiology Society of India with us here. We have Dr. Naveen KB, who is the president of Enigma. We have Dr. S.T. Venkateshwaran, who is a professor and head of Department of Yoga at Government College of Yoga and Ashwati, Government of Tamil Nadu in Chennai. And we also have with us a dynamic young expert researcher scholar, Dr. Chandrasekharan, who is here to moderate this session. And I open the floor to Dr. Anasuya to introduce the moderator, Dr. Chandrasekharan, and he will take on the floor from then.
Good morning, everyone. Thank you, sir. Good morning, everyone, and welcome you all to the third day of our webinar series on the occasion of International Day of Yoga. The theme of today's webinar is Yoga for Heart Health. The moderator of this day is Dr. A.M. Chandrasekharan. He is a yoga and naturopathy physician from Dr. MGR Medical University, Chennai. He completed his Masters of Public Health from SRM School of Public Health, Chennai. Currently, he is a Coelho's postdoctoral fellow at the Center for Chronic Disease Control, New Delhi, and Emory University, Atlanta. He is also a member of American Heart Association and European Society of Cardiology. He is currently coordinating the largest clinical trials of yoga and cardiac rehabilitation, which has recruited nearly 4,000 patients. In addition, he is also establishing a similar clinical trial of nearly 4,000 patients with heart failure across 15 hospitals. He is also a co-investigator of yoga-based cardiac rehabilitation program on pulmonary hypertension and 4 other studies on COVID-19, which are in various stages of completion. His skills and expertise is in clinical research of behavioral interventions, systematic reviews and meta-analysis, quantitative research, chronic disease risk factor management, and yoga and naturopathy. I'll hand over to Dr. A.M. Chandrasekharan, and he will introduce our eminent panelists and moderate today's session. Please welcome Dr. Chandrasekharan.
Yeah, good morning.
Dr. Chandrasekharan, yes, please.
Yeah, good morning, all. I'm very grateful to CCRYN and the team of panelists for joining us in this great morning for a wonderful deliberations on yoga for heart health. So it's my privilege to introduce the experts for the session. So to begin with, we have Dr. Manchanda. He's a recipient of several national and international awards, including the 4th highest award for civilians in India, Padma Shri Award by President of India, and he has won Lifetime Achievement Award by Cardiological Society of India. He is a former HOD of cardiology in AIMS, and he is the first in India to perform angioplasty, and he is the first in India to conduct and randomized control trial of yoga in cardiology. He is an 80 years young cardiologist who practices yoga every day, and he has done original research in the field of yoga, meditation, high altitude problems, and lifestyle modifications. Also, he is a editor-in-chief of Journal of Preventive Cardiology. We welcome you, sir. The next person I am inviting is Dr. P.P. Mohanan. He is the current Cardiological Society of India's president. He is the director and HOD of cardiology, Westford High Tech Hospital, Thrissur, and he is a past convener of Cardiological Society of India for coronary and non-coronary specialty. He is the man behind the largest acute coronary syndrome registry from India. That's Kerala ACS registry, and also he is with the largest randomized study in quality improvement interventions in acute coronary syndrome management. And also he is the first one to do the similar kind of study in chronic heart failure in India, and he has received the Dronacharya Award, that's Excellency Award in Cardiology. We welcome you, sir. And we have Professor Prabhakaran, and it takes a full day to introduce himself for his excellent great achievements in the field of cardiology and research and medicine. So To be short, he's a cardiologist and epidemiologist by training. He's an internationally renowned researcher and he's currently the Vice President, Research and Policy at the Public Health Foundation of India. He's Executive Director of Center for Chronic Disease Control, New Delhi, and he's a Professor of Epidemiology at the London School of Hygiene and Tropical Medicine. In addition, he holds scientist position at Harvard School of Public Health, McMaster University, and Simon Fraser University. Also, he is the head of the WHO Collaborating Center for Surveillance, Capacity Building, and Translation Research in Cardiometabolic Conditions in Southeast Asia. He was elected as the Fellow of Royal College of Physicians in 2011, followed by National Academy of Sciences. Currently, he is the chair of Science Committee of the World Heart Federation, and he is the chair of the Executive Council of International Society of Cardiovascular Disease, Cardiovascular Epidemiology and Prevention. He heads the Center for Chronic Conditions, Control of Chronic Conditions at PHFI, which is a joint initiative of 4 leading institutions: Public Health Foundation of India, London School of Hygiene and Tropical Medicine, All India Institute of Medical Sciences, New Delhi, and Emory University, Atlanta. So this center is conducting cross-cutting research in the prevention of chronic disease in India and the developed world as a whole. His work ranges from mechanistic study to understand the causes of increased propensity of cardiovascular disease among Indians, to developing solutions for this CVD management and prevention through translational research and human resource development. He has received funding from most of the funding organizations in the world, we can say, to notably NHLBI, Wellcome Trust, European Commission, our Indian bodies. He has trained more than 50 postdoctoral students and doctoral students so far. He has authored several chapters and he has more than 500 scholarly papers with an H index of 91, which is one of the most, and he is listed as the most researcher in India in medicine by Scopus and Department of Science and Technology, Government of India. He is also the lead editor of cardiovascular disease, lead editor of the cardiovascular disease volume of the disease control projects. He's the editor, and he's currently the editor of the Tendon's Textbook of Cardiology, a 2-volume comprehensive textbook on cardiology for Indian cardiologists and fellows. We welcome you, sir. It's a privilege to have you here. And we have 2 more yoga and naturopathy experts joining us on the panel. To begin with, I would like to welcome Dr. Naveen K. Vishwesharaya, a Fulbright Fellow and currently an international research in leadership fellow with the Australian Research Council for Complementary and Integrative Medicine, and he's a consulting integrative medicine physician. He is an accomplished yoga and naturopathy researcher, and he's holding honorary professor at University of Technology Sydney, Transdisciplinary University Bangalore, research professor and co-principal investigator of Center for Excellence in at SDM College of Naturopathy and Yogic Sciences, awarded by Ministry of Ayush. He is distinguished to be member of WHO Working Group on Naturopathy Practice Guidelines. He is a member of expert group in the World Naturopathic Federation, and he was awarded the first ICMR Center for Advanced Research in Yoga and Neuroscience in 2007, and he's a faculty member of Rajiv Gandhi University of Health Sciences, founder president of INIGMA, the Indian Naturopathy and Yoga Graduates Medical Association, and the first yoga naturopathy physician to be awarded Doctorate of Science for his accomplishment in the field of yoga, and also he is the first one to receive PhD in yoga and psychology among the yoga naturopathy doctors. He also has several accolades to his name. He has lectured at several places, including Harvard, MD Anderson Cancer Center, Center for Brain Research, and research accomplishments includes he has published more than 50 research papers, original research papers, guided 8 doctoral students and several master scholars. So we welcome you, sir, for this event, for sharing your experiences and knowledge in this area. And finally, nevertheless, we have one clinician, which is very, very essential for our discussion deliberations, Professor Dr. S.T. Venkateswaran. He's currently Professor and Head Department of Yoga at the Government Yoga and Naturopathy Medical College, Chennai. His experience, is around 30 years in this field of yoga and naturopathy with his clinical management. He is visiting and guest faculty at many prestigious institutions, He has received Best Doctor Award from Government of Tamil Nadu, Best Doctor Award from Tamil Nadu MGI Medical University. He has presented in various international and national conferences. He is a member of various academic committees of universities and institutions. He has published a chapter on obesity in the Ministry of Ayush textbook. He has presented program on, he's kind of a more related to a public kind of person, presenting so many awareness programs with the public, and he writes regularly in columns in the leading newspapers and places. Let's welcome Dr. S.T. Venkateshwaran sir. We welcome you, sir. Okay, so let's start the session with a brief discussion on how the experts entered into the field of yoga and heart care, or how did they enter into the field of yoga? Let's begin with Dr. P.P. Mohan sir, the President of Cardiological Society of India. Sir, please unmute.
Thank you, Chandrasekhar, for the opportunity. It seems that I am the odd man out. All of the guys persons on yoga, Prabhakar with a huge number of trials on yoga. I suppose I will also try to play the devil's advocate in here. Anyway, I think the last time I heard about yoga and more of a transcendental meditation at that time, when it was in the early 70s, when the Guru Chinmayananda visited my medical college at Calicut and talked to us about at length about he's such a vociferous with so much of oratorial skills, and you get mesmerized by his skills. And he was mainly talking about the importance of transcendental meditation for the medical student. That was the time, mind you, there was a lot of suicides happening in medical college campus, and we wanted somebody with a very steady mind to calm the entire student population. But of course, after that, we have Kerala is again, it's famous for its Ayurvedic practices. So yoga somehow got connected with it, and that has been a bit. But I should admit that I'm not a regular practitioner of it. We have, of course, Prabhakar will remember when we did the cardiology national conference at Kochi a few years ago, we had a regular yoga session in the morning from 6 to 7. Surprisingly, the international faculty got addicted to it and was requesting us to have it more often. But that was the time when, and of course, I was also in the initial part of the yoga care trial. I was involved, of course, even though I couldn't complete the program because of the logistics. But that was the time when I got introduced to it, and I look at it as an excellent program which is suitable to India for the rehabilitation, which we are definitely going to discuss. Thank you.
Thank you, sir. Let me go to Professor Prabhakaran, who has recently published the largest cardiac rehabilitation trial from yoga, based on yoga in the Journal of American College of Cardiology. Let's hear from him his journey of yoga. Over to you, sir. Sir, please unmute.
Okay, can you hear me now?
Yes, sir.
Okay, right. So, Chandrasekhar, thank you very much for that long introduction. It was really not required to have such a long introduction. It's quite boring to other people to listen to that kind of introduction. Anyway, having said that, you asked me a question, when was I introduced to yoga? I was introduced to yoga in school, because in our school we had the yoga practices. So we had a yoga period, and that's how I came to know about yoga. But when I got into the medical profession, when was I introduced to yoga? I was part of the trial which Dr. Manchanda conducted in the year 1997-98, where we randomized patients who had undergone bypass surgery. Patients who had undergone coronary angiogram and were found to be inoperable. They said these vessels are very small. You cannot operate on these individuals. So we randomized them into two groups. One group got yoga care with intensive medical therapy, The other group got intensive medical therapy alone. And then we evaluated them at the end of 1 year in terms of looking at what was their exercise capacity compared to a baseline, and at end line, did it improve or not improve, or did it decline? Second is we looked at anginal episodes, history of frequency of chest pain. And the third, we looked at the left ventricular function, because many of these people had poor left ventricular function. And so it showed that on all the parameters, yoga really helped. Of course, it got published in the Journal of Journal of Association of Physicians of India, the JAPI journal, because the international journals at that time wouldn't believe that yoga could work. There were, of course, some of the limitations. We were very early into clinical trials. We had not understood the nuances of clinical trials at that time. So there were limitations to the study, so it got published in JAPI. But it has been cited at least 300 times after that. So that was my first introduction to yoga. Then we kept thinking about it as to do a large study. So in 2009, the ICMR and the MRC UK combined together and asked people to apply for research proposals, which were of importance to the Indians, or which were of importance both to India and UK. So one of my colleagues in UK, Dr. Sanjay Kindra, he said, why don't we do a mechanistic study of yoga, do a 100-patient study and things like that. So I said, look, when you look at the literature, you have so many of these small studies, 20, 30 patients. I think if we have to do a large clinical trial. And the question arose, would it be possible for us to do a large clinical trial? Because the estimated sample size at that time came to 4,000 with almost expected outcome of 20% in the control group. So we somehow managed, we worked hard, we said we will do it. And we managed and we did the trial. So that was my major exposure to yoga. After that, I have looked at yoga from multiple angles. We will talk about it later when your second round of questioning comes.
Thank you, sir. So you started yoga from school onwards. That's a new message for me as well. Okay, now over to Dr. Naveen K. Vishwesharaya. So your journey in yoga, please. Please unmute.
Very good morning to very distinguished panelists. Very delighted, thankful to CCRYN and Chandrasekharan for putting this together. I started my life into yoga as a professional. At the age of 18, that I got into this course. Well, it was a gamble of sorts because in 1989, I happened to bump into the very first college of India in the very first batch. So it was a big gamble for my parents and for myself to explore to be a yoga and naturopathy physician. But then I had joined for dental sciences. I wanted to be a physician. The oral pathologist told me that you take a 3-month sick leave and try this course in yoga and naturopathy. Looks to be a futuristic medicine. If you don't get on well there and if you don't like it, your sick leave ends and you will join back to dental sciences. So that's how I really reached Dharmasthala on a really experimental basis to find out if that interests me. And rest is, as they say, history, that I didn't go back to dental sciences. I'm very thankful that I didn't go back to dental sciences. And there onwards, we saw that it worked in our hospital, although it was small when we were studying, 30, 40 beds. We really saw yoga and naturopathy, more so yoga at work, and we really saw clinical outcomes. And then the research, although there were very early studies, largely by Dr. Chandra Patel on hypertension, and other studies were coming in 70s and late 70s and early 80s. Dr. Nagaratna and Dr. Nagendra published a landmark study of their study on asthma in BMJ. So those really gave me a lead that yoga research is possible. And I started volunteering from 1990 to SVYASA. And their first international conference was in 91. And that's when I decided I'm not going to be a clinician. I'll start into yoga research. While I started, they wanted to test this. Who is this yoga and naturopathy physician? Is he capable of research? So they asked me to try something of my own. I had started my research on pulmonary tuberculosis because there was nothing, no hospital, there was only a sanatorium in our internship. So they asked me to do a larger clinical trial on pulmonary tuberculosis. So we did that and published in journal Respirology. But later I shifted to yoga and neuroscience and went on to do whatever I could do. Into heart health, it's more of psychophysiology research. As early as 1994-95, we started to work with Indian Institute of Science. And actually, we had fun putting together a very manual analog ECG machine, A to D converter board, and then convert that into a digital signal and write a very simple software for heart rate variability. There was no ready heart rate variability equipments then, and nor the analysis software. So that was fun, and that's how I really got into psychophysiology and autonomic function testing. And we really did early studies on heart rate variability in yoga in India while at S. Vyasa. And since 2015, I moved on to from hardcore lab research to translational research because I decided that not much of our research doesn't reach bedside. And since then, we do cardiac health programs, cardiac rehab.
So that was a blissful moment. I think you choose the career of yoga naturopathy over medical dental sciences. So thank you. Now over to Dr. Professor Venkateshwaran. Sir, your journey in yoga naturopathy.
Yeah, namaskaram to everyone. I would like to thank the organizers who was coordinated for this. And basically, my whole family is full of modern medicine background. And my own brother, who was actually more interested in yoga than me, in fact. So after the +2, I was trying to get through the modern medicine, but because of I couldn't get it in the first attempt. But my brother was so confident that the yoga is going to be the futuristic one. And there was the only one college in whole India which is recognized by medical university. That is, that time it was Usmania University. And but once I have joined there, the amount of the result what patients were getting it through the lifestyle diseases was amazing. So that is how completely I have become into the clinician, my interest.
Thank you, sir. So it was it was very great to listen how the experts, the stalwarts in yoga and naturopathy entered into the field of yoga and cardiology. Now with this quick information knowledge, let's go to the next theme. We'd like to present your individual contributions in this area of yoga and cardiology in a short slide or a verbal presentation. Let's start with Dr. Naveen Kevi.
Okay, let me share the slide. Is it being shared?
No, doctor.
No. I've kept this open and then I'm trying to share.
Now, yes.
Now it's
okay. So very briefly, I was CCRYN has asked me while we have two stalwarts in cardiology research, starting from, of course, Dr. Manchanda sir and then Dorera sir. And then, of course, we have a cardiologist in Dr. Mohanan. Chandrasekharan has laid out and asked me to look at how we can explain the effect of yoga and in terms of fundamental physiological mechanisms, as my large body of work is in psychophysiology. So these are very familiar underlying mechanisms drawn for cardiac diseases and therefore the recovery from yoga interventions. So I would cover one slide each on each of these, because these are important for any yoga and naturopathy practitioner or a researcher who are our audience today. And I know there are going to be questions on primary and secondary preventions later on, but I want to use this slide to say that there is something called primordial prevention, where the risk factors are there, but there is not a cardiac event as yet, and or even the classical risk factors like dyslipidemia, obesity, diabetes is not even set in. So it is at that stage one can also start looking at, and interventions at that stage have contributed to 30% reduction in first cardiac event. So as yoga and naturopathy physicians, lot of times we do have access to this population and can intervene in primordial prevention. There's one element that I've already always touched upon, and it really is important, both from the point of view of yoga philosophy and practice and techniques or therapy, and from the point of view of analyzing individual vulnerabilities, and also when we kind of customize a research-based protocol into individual, this personality type called gunas, or classical personality type, which is personality type D, is strongly associated to heart disease. And there's a schematic representation here for the physicians and students who are here with us. So where there are direct correlations drawn from type D personality for the three cardinal mechanisms that we know of: HP axis, immune system, and sympathetic drive. And it's all the way has its impact in psychological, psychosocial impact, vasculature, and of course arrhythmia. So such is a strong correlation, and it's very important for us to factor in this. I'm very interested now as an integrative medicine physician and a rehabilitation personnel in looking at first level risk factor. And now tachycardia, or increased resting heart rate, is looked upon as a early risk factor, even before we start to see other classical precursors or predisposing comorbidities for heart disease. And as we see now, quite a few guidelines have adopted this in risk evaluation. And we also can see, as it is here in this schematic representation, that has direct impact on atherosclerogenetic processes that we know of. This is something that is largely talked about in our work in psychophysiology, whether it is looking at yoga techniques, that is postures, largely breathing exercises and meditation, as we categorize them as body work, breath work, and mind work. And one thing that really gets addressed in yoga is reversal or reduction of hyperaroused state. And there is strong correlation for hypertension, diabetes, and heart disease of hyperkinetic state and hypersympathetic activity. And most underlying mechanisms for the effects that we see in yoga is attributed to the reversal of this. For those, again, we know that this is a schematic for stress and heart disease. We know that, and how these mediatory responses from inflammation to insulin sensitivity, oxidative stress is all at play. This was particularly important when we looked at the other two underlying mechanisms that I'll talk about. Dr. K.K. Deepak in several studies come up with summarizing how autonomic dysfunction is corrected, or a stabilized autonomic sympathetic tone through vagal stimulation and parasympathetic activation. Proposed two pathways is quietly getting accepted now in most papers. At discussion, we kind of accept and discuss the underlying mechanism under these two pathways. I'm also again drawing these other less known, less talked about mechanisms because this is important in our everyday clinical practice, where feeding behavior is very important. There's a schematic representation of a very interesting correlation of time of eating to the quantum of weight loss. And of course, we know there are early leading evidences from yoga intervention of leptin-ghrelin balance, where it is attributed to people who take yoga lifestyle or or have more susceptibility to choose much healthier food options. A very interesting correlation, as I said, early versus late eaters. There's a significant increase in quantum of weight loss. That's very important for us to, when we talk about yoga, we often don't talk about yoga diet because we consolidate yoga and naturopathy intervention, and therefore the diet becomes very important, and that's why weight loss becomes a central central clinical goal in achieving clinical outcomes for diabetes, hypertension, or heart disease for that matter. Very interesting, another point that I want to touch upon that again, a lot of yoga and naturopathy physicians get to see is broken heart or Takatsubo Syndrome, TTS as it's referred to. And also very interestingly, these days, there's also something called happy heart syndrome. This study aims to really correlate certain standard set of worrisome traumatic experiences versus happy experiences. And they've mapped, as you can see in this graph, of different types of impacts, and there is a significant reduction in the affect, in the mental affect, inducing happy heart syndrome from broken heart syndrome. So that's again something that we use in everyday yoga and naturopathy practice, and that's something that we can attribute to our clinical outcomes. Something which is very important now also in COVID times, we know that arrhythmias are one of the consequences of infection, but also a whole lot of other lifestyle comorbidities also is known to have impact and influence on cardiac arrhythmias. So we know the stress again has a direct link to the incidence and quantum of atrial fibrillation. And there are some early studies looking at atrial fibrillation directly and use of yoga as an intervention. And there's one study which draws some mechanisms, which we of course know. And this neurogenic syncope and how yoga can actually stabilize and not have syncopic attacks. And this is a combined schematic representation where there is autonomic modulation dysfunction leading to arrhythmia and the known pathways, again, stabilization of autonomic tone and the reduction in risk factors, and of course, inflammation, oxidative stress, and endothelial function improvement are attributed to how yoga can bring about stability in these patients with cardiac arrhythmias. So these are the couple of mechanisms that we look at when we discuss the results of clinical outcomes of either early studies starting from Dean Ornish and then Dr. Manchandas, and then the Benson groups, another large clinical trial that came, and of course now set of yoga care trials, large trials of chronic disease, Center for Chronic Disease Control. We're looking at secondary prevention and rehabilitation. So all of those studies basically essentially look at those factors in explaining the clinical outcomes of yoga. One last thing that I would like to share before I end is that we in our clinical practice, I didn't put a slide here, that look at heart rate variability as a clinical research variable, but also now we have taken that into a routine clinical evaluation. And there are now devices which makes it easy. In fact, there are smartphone apps where 3-minute to 5-minute data makes it a strong correlated validity to that of ECG, standard ECG data for heart rate variability. And we routinely use that to monitor resting heart rate and heart rate variability variables. So that's in summary the mechanisms that we look at in explaining and possible mechanisms for clinical outcomes of yoga as a therapy. Thank you.
Thank you, sir, for sharing the ideas or the mechanisms behind the applications of yoga in cardiology. Now, let me welcome Professor Manchanda sir once again. Because of
Thank you
technical
very much. I'm
Join-
sorry, I had a lot of difficulty in joining, right?
Yes.
This is on my laptop, I am doing it right, yes.
Okay. Sir, just to begin with, the question which is asked to all the panelists previously, can you please describe your journey of yoga in couple of minutes? Thank you.
Yes. I think my journey of yoga is possibly the oldest one. It started somewhere in 1993. I was inspired maybe by Dr. Dean Ornish, who had written an article in Lancet. And I was, of course, at All India Institute of Medical Sciences. We were always looking for cheaper alternatives and all. There are a large number of patients who could not be operated at that time. Angioplasty had just started. So I was looking for a cheaper version, and Dean Ornish's work impressed me quite a lot. But when we went through the article, it was not a very user-friendly program because the program was carried out in the hotels. And then he had taken subjects which were only 30% or 40% blockages. So I took up a project with the CCRYN long back in 93. This was a 2 years project on looking at whether advanced atherosclerosis can be sort of regressed with yoga lifestyle. And this is for the first time that we did a study. At that time, people were not really very much used to yoga. I had a lot of hindrances, a lot of obstacles. Even my colleagues and other people said, "What are you doing?" And all this yoga is not, it was not acceptable term. Even at that time, yoga term was not acceptable to any journal. I was in touch with Dean Ornish, and Dean Ornish said that he wanted to use the word yoga, but they said, if you remove it, we'll take it. Lancet took it when he called it intensive lifestyle. It was nothing but a yoga lifestyle. So we had a lot of difficulty. I did the angiography of these patients in All India Institute of Medical Sciences. Number of colleagues, Dr. Prabhakaran and others helped me out in all that. And it was a small study of 46 patients in which we did angiography. We did this yoga training. And we used to have these camps. It was a in-house sort of yoga training for about 7 days in Adhyatmik Sadhana Kendra. And we had the very good instructor, Swami Dharmanandji, who taught more or less the same methods which are being done now. And I used to follow up these patients and all. It was very remarkable, you see, to see these patients. Whatever results we got, I think what these patients said within a week or two, they started saying that they are feeling better already. Their angina, which was quite severe, started regressing and all. So anyhow, we completed this study with angiography and we published it also in about 2000. And I sent to some of the foreign journals. They always wanted to remove this yoga word, which I did not want to. And ultimately, we published in Journal of Association of Physicians of India. That is the regression of advanced atherosclerosis by yoga lifestyle. And we used the term for the first time, yoga lifestyle. It was not really used earlier because they were using the term. Because as I think in the discussion, we will talk what yoga is. To me, it is the healthiest lifestyle ever devised. It consists of not only physical, it consists of 4 components. The physical component is that we have to have a good diet, sattvic diet, vegetarian, which we know is good for the heart and so on. We have to do exercise. Exercise can be done with yoga or walking. And third is no addictions like tobacco and alcohol. I think physical component, everybody agrees. The second component of yoga is stress management. That is the mental well-being. And I think there's no doubt that yoga has been shown to decrease this stress. And third is, I think, emotional well-being. I think we have neglected this emotional part in our medicine completely, like negative emotion, like anger, ego, hostility, ego, and jealousy. We do not know too much roles of this. We know that stress can cause cardiomyopathy, cause arrhythmias, etc., etc. But we don't know its real role. There are studies in animals which was quite impressed that even a animal fed in low-fat diet, the low-fat diet never causes atherosclerosis. But if they are stressed markedly, they develop atherosclerosis. So with the almost very little sort of cholesterol in the body, they can develop atherosclerosis. So we don't know the role of emotions. And positive emotion like compassion, there's a study which I was impressed in one of the journals of pathology long back, in which rabbits develop atherosclerosis consistently, but a group did not develop, and the technician used to take them out, just fondle them. A little compassion prevented atherosclerosis. Their serum lipids were very, very high, more than 1,000, 2,000, but they did not develop. So I think this emotional well-being is very important. We don't know much about emotion. We know a little bit. So that is the third part. And the fourth is the spiritual well-being. And we know the effects of spirituality. That is again compassion and helping others and so on. So I think to me, yoga lifestyle is nothing but taking care of diet, exercise, no smoking, and stress control. So that's why I call it a lifestyle polypill. I use this term lifestyle polypill long back, and I thought it was better than pharmacological polypill. We have polypills to reduce atherosclerosis because this polypill does not have any side effects and it can improve many conditions and all. So I think we reported this, and this article has been very widely sort of quoted, cited very large number of times and all. So the journey started at that time, but interacting with the patients, I was so impressed that we started running what we called as the heart reversal camps. Actually, there's no reversal. If you see the article that we have, actually reversal is very little, 2 to 5%. But the clinical improvement is marked. We were able to see that the unstable angina myocardial infarction reduced by as much as 8 times and so on and so forth. So what we postulated at that time, that reversal is a misnomer, that is modification of the plaque. Maybe we make unstable to stable plaque. And this is, I think, for the future really to do these studies. We should really do intravascular imaging and see whether we are able to change, because later on studies came that the mortality can be significantly reduced. The study from United States, the transcendental meditation, if you give yoga for 7 years, there's a 54% reduction in the mortality and hard endpoints like stroke, myocardial infarction. So there is a significant improvement in the clinical parameters. Of course, we did not study that. Other studies have shown it, although the regression was very little. So I believe that we were able to. Secondly, we had the impression that maybe it is the early atherosclerosis which could be reversed and all. So I took up that project in Gangaram Hospital some years back, and we took patients of metabolic syndrome in which we have early atherosclerosis, which is of course picked up by the carotid intimal median thickness. People have taken this carotid intimal median thickness as a surrogate of atherosclerosis. So we took this 100 patients, and again, half of them we gave yoga and half were control. And we did find that there was a regression as far as the CIMT was concerned in these patients. In addition, of course, we found several parameters like the systolic blood pressure, the blood sugar, and central obesity also decreasing. Others have shown insulin resistance. So it was quite heartening to see that so-called we can cause regression or reversal of atherosclerosis, especially if we do. Of course, there are a lot of limitations in these studies, and I think more studies on regression need to be done. We know that they have been done with large number of drugs, statins and other, and they have used intravascular ultrasound. I wish in future somebody does at least intravascular ultrasound in these patients of coronary artery disease, or at least in the periphery arteries or the carotid. We could do the Doppler and see what happens to these atherosclerotic and all. I think this is an area which is wide open and all. But at that time, as I said, there was a lot of resistance. When I was presenting this, I was ridiculed that this yoga will take the surgical sort of work away from this, because most of the patients were 2 or 3 vessel disease. I could not believe that they will do so well, because these were patients, fortunately, who said we do not want surgery and all, for they were not having very severe disease. Left main was not there, left ventricular dysfunction was not there, But the improvement that I saw was tremendous. Not only subjective, we did objective like treadmill, etc., etc. So we have been running those so-called camps for the last about 25 years, and we had now more than 80,000 patients. Initially, there was nobody who was ready to believe our data, but I was very happy when Courage trial came. The first time they showed that medical treatment, optimal medical treatment is as good as angioplasty or bypass. There were several studies which came, and now I think ischemia study, which is the largest study ever done, has shown that optimal medical therapy. I always object to these studies because I don't think these are really optimal medical therapy. Because optimal medical therapy is you have to take care of the stress also. You have to do yoga also. Because we showed in our study 20% relief of angina in these patients who were being followed with the yogic lifestyle and 20%. And we also showed objective improvement in the form of treadmill testing and also thallium testing. That also improved markedly. So I think optimal medical therapy, apart from the drugs, etc., should include this stress management. And over the years, I'm very glad that at that time the publications were very limited. I'm very thankful to the CCRYN, and at that time they published the first monograph of reversal of heart disease, and our all this methodology was also described. It's a very small booklet, but for the first time they published that, and I think they circulated to a number of people. And subsequently, I think in the last 5-6 years, yoga has become very popular, and I'm very thankful to our Prime Minister for making it popular throughout the world. It's now accepted all over the world. Even the journals, there's no medical sort of meeting of any branch you can, or any discipline in which yoga is not really used at all. Yoga is accepted now, and also certain people like Ramdev, etc., who have popularized, made it at home. And of course, the research by CCRYN and by the Bangalore group and people like Dr. Prabhakar, who have done really remarkable study. So studies were very, very small. Over the years, I think it came for the so-called primary prevention of this. And I got interested into that. And I think the reason why I went to that, I used to ask patients, see, our knowledge has increased markedly. The patient's awareness has also increased. But why is the disease increasing? You see, we are advanced so much in the treatment. We know so much how the disease occurs. So very simple to control this disease. Just modify your diet, do some exercise, avoid stress, and don't smoke. And the disease will be eradicated. That's what I believe if you do it from the child. But in spite of this knowledge, most of my patients have it. They don't do it. I used to ask them, why don't you do exercise? Doctor, I want to do, I get up in the morning, but my mind says, don't go today, go tomorrow. That tomorrow never comes. Then I found out that it is the mind which is weak in these patients, the weakness of the mind which causes all that. Actually, we know that coronary artery disease or cardiovascular disease is a lifestyle-related disease. Lifestyle is a complicated procedure, and lifestyle choices like smoking, exercise, alcohol, etc., have a lot of to do with the mind-body sort of complex. It's the mind-body interaction which is very, very important. It is a behavior which mind-body interaction decides the behavior. So I came to the conclusion it's the behavior of the individual which is not allowing these people to follow what they know. And therefore, I thought that one should be doing a lot of studies in this yoga for the prevention of coronary primary prevention. And I'm glad that there are hundreds of studies now, actually thousands if you see, in hypertension, diabetes, in stress control, even in dyslipidemia, in inflammation and oxidative stress, etc. And most of them have shown. The only problem with these studies is that these are small studies. So I think in primary prevention, it is more or less established, although the studies are small and there should be better studies available, large studies, mega trials are available. In secondary prevention, we had done that, can call regression, etc. Then studies by Dr. Prabhakar and some people from abroad have translated. They had also shown that it could be useful for secondary prevention, and of course for arrhythmias and heart failure.
Sir, Dr. Vanchanda, you are on mute. Please, you have to unmute yourself. Am I audible now?
Yes.
Yes, sir.
Okay. what I was saying is that its role in primary prevention is established, although the studies are small and we need larger studies and all. I got interested into this. We did a study in ambulatory blood pressure.
So I think you are muted again.
Again, so
The interest of time.
okay, I'll keep it pressed, I guess. I can see that. Am I audible now? So I think it has a tremendous role in hypertension. As I said, we did a small study in which we found that pre-hypertension could be controlled very easily by ambulatory blood. So there is a need for larger, I think, studies with ambulatory blood pressure, because we have an impression that even this nocturnal hypertension, so many, syndromes of hypertension which are picked by ambulatory blood pressure could be corrected because they are all autonomic imbalance. So I think more studies are needed in hypertension. And as I said, both for primary and secondary, there are small studies and larger studies are needed. And I am very glad that at least 3 groups have taken the initiative. Leading is, of course, Prabhakar, which he published the largest study ever in one of the best journals.
I think you're muted again, sir. So,
okay.
Thank you.
Automatically, maybe the time is over. The second group is from Bangalore, the SWASA. Dr. Nagendra has done a huge work in diabetes mellitus, and they presented their work in international, in the American Diabetic Association, in which they showed that pre-diabetes can be controlled in a very significant number, large. And the third group is, I think, Patanjali group, which they have shown in central obesity. They have also done a huge multi-central. So I think this is the time for doing these large multi-central trials and all that. Theoretically, and small studies do suggest. Only thing is, yes, yoga has not got incorporated among the clinicians. I wish that everybody can incorporate. It's very simple to do. And I think this is what we should focus on now, that although the data needs to be collected more and more, but because it's a cheap method which can be easily done without any side effects, very cost effective, it could be very helpful in primary.
Thank you. This is a really great,
right. I think that's all I will like to say. Sorry, I've taken.
Thank you very much for your great suggestions and kind of a brief journey of the entire yoga research in this area of cardiovascular diseases. It was really great to hear from you, sir. You are always inspiring as usual. Now let me pass on the stage to Professor Prabhakaran to narrate his work in this area very briefly and the hypothesis, whatever he is having in mind to expand this area. Over to Prabhakaran, sir.
Yeah, thank you, Chandrasekharan. I just wanted to, Dr. Manchanda spoke a lot about yoga and what can be done. I just wanted to start off with one of the statements which he made, that we attempted reversal of atherosclerosis and that did happen. It was just 2 to 3% reversal. But I think even a small amount of reversal is very important, because blood flow, if we look at the physics of blood flow, there is something called the Poisson's law, which says that the blood flow is dependent on inversely proportional to the 4th power of the radius of the artery. And therefore, I think small reversals also is beneficial, and we should look at that aspect. So having said that, I thought I will talk about 4 things. What does yoga mean to me? Because you had asked that question earlier, what does yoga mean to me? What cardiovascular diseases can benefit from yoga? What are the methodological limitations of the studies that we have done so far? Something about the research infrastructure, and what are the domains that require attention in terms of yoga. To me, yoga means a complete lifestyle package, like what Dr. Manchanda said. But I think I will go beyond that, because if you look at the 8 limbs of the yoga, the Ashtanga yoga, there are things like, for example, yama, which is the attitude towards the environment. And I think it's very important in this era that we have to reduce air pollution, we have to reduce climate change, and yoga is a good example of that attitude. I mean, the attitude towards the environment is an important attribute. Of course, the other 3 attributes which we use, the asanas, the meditation, then the lifestyle, which includes the right diet, avoidance of tobacco, avoidance of alcohol, stress management, so on and so forth, are extremely useful. The third aspect is Jnana Yoga, because we also need to improve awareness amongst people. So awareness is also an important attribute because many of the people are not aware about cardiovascular disease. So the yama, niyama, asana, the dhyana, the dharana, all these attributes actually improve the health of people, and therefore yoga is a complete package in terms of improving health of individuals as well as health of populations. So that's the first point I wanted to make. Second is in terms of cardiovascular disease, I think we don't really require major trials for health promotion and prevention because it's common sense. And there have been a lot of small studies which show, and by the way yoga helps is very clear. I mean, what it does is it transforms your sympathetic milieu to a parasympathetic milieu, which is protective in terms of the stress on the arteries, reduces the heart rate, increases the heart rate variability, and so on and so forth. Therefore, there is a clear-cut role for yoga in health promotion and primary prevention. Where we need research is in secondary prevention, because you need to actually implement yoga on scale, and for that you really require research evidence. So in that we embarked on this yoga care trial, where we recruited 4,000 patients from 24 centers, but it was a highly scientific process, even in terms of choosing the right type of yoga practices, in terms of the asanas, in terms of the meditation practices, in terms of pranayama. We actually referred to ancient textbooks. We spoke to yoga experts. We spoke to Professor Manchanda, who's both a yoga expert as well as a cardiologist, but we of course spoke to several yoga experts in terms of identifying what could be the right package, what was safe. As Professor Manchanda said, we also faced initial resistance. People were frightened to introduce yoga, especially after a heart attack, because they said that there may be, it may be dangerous, it may kill people. So we had to do the study in UK, a small study to 100 patients to show that it was safe. And if we look at the results, many of you may have read that article in JACC. If you look at the results, the divergence actually comes up after 1.5 years. And why is that? That is because in the first 1.5 years, only low-risk patients were recruited. We had to really advocate with all the people who are participating in the trials in terms of having high-risk patients. So with that, we kind of showed that quality of life improves, return to pre-infarct activities improve, but there was a 9% reduction in cardiovascular outcomes such as mortality, repeat myocardial infarction, and stroke. Now we are following these patients up. By next year, we'll get the follow-up, because one way of increasing power of a study to show that the benefit indeed is true is either to increase the sample size or to increase the follow-up. So because we had stopped the study, we have increased the duration of the follow-up, and we're following these patients up, and so we get the results. What are the other areas that we are looking at? One, I think we are looking at heart failure. We have been funded by ICMR to conduct a very large heart failure study, again in 15 centers involving around 3,600 patients, which also has a mechanistic component in 200 patients. We will understand what mechanism actually works in heart failure. Is it the hypothalamic pituitary axis mechanism? Is this the renin-angiotensin system mechanism? Or is it the stretch on the atrium, atrial mechanism? So we are looking at all the three mechanisms and trying to identify which one is causes a big change in yoga. The third study that we are looking at is in pulmonary hypertension. Is a condition where when it happens in young people, mortality is very high, but quality of life is also extremely poor. So we want to look at yoga as to whether it helps or not. The fourth study that our group is embarking is on HIV individuals, whether it can improve CD4 counts in patients of HIV. That's a fourth study. The fifth study that has been planned is in Fontan surgery, which is a complex surgery for children with congenital heart disease, complex congenital heart disease. Because one of the things yoga can do is it can improve lymphatic flow, and there is a problem with lymphatic drainage in post-Fontan surgery, and therefore there's a basis to do this study. So the question that arises is, what are the unanswered questions that we have in terms of what can be done. I think in terms of unanswered questions, we do have Dr. Manchanda pointed out about hypertension. I think one of the things in hypertension is there is a what is called as a dipping phenomenon. If you look at 24-hour ambulatory blood pressure monitoring at night, normally there is the blood pressure dips. Among patients in whom the blood pressure does not dip, there is a higher chances of mortality. Air pollution, for example, abolishes the dipping phenomenon. Now the question is whether yoga can improve the dipping phenomenon and can change. So that's one question that we need to address. The second thing that we need to look at is how can we scale up the yoga? I mean, we have done these big trials. How can we make it a common practice in hospitals? So that requires what is called as implementation science research and to some extent policy translation. So these are some of the things that may be required. But there are some issues in terms of yoga. I think we have to standardize yoga. The style of yoga, there is always a issue. People say that our yoga is better than your yoga. Asanas are better than meditation, or pranayama is the ultimate thing. So I think you need to have a holistic approach. Although we say that our ancient practices are holistic, the common day, the common practitioners now are fighting about which component is better. I think we should avoid that. The second is the dose and delivery of yoga is important, and I think that needs standardization. The components of the yoga intervention, which we have worked out for our yoga care, but we might require it. If somebody has osteoarthritis, how do you get yoga done? So you need to work on that. Then we also need to train instructors, because instructors come from multiple schools of thoughts and they actually use their own ideas in terms of training. So we need to standardize them, and we need to facilitate home practice. I think a buddy mechanism where a wife or a spouse actually participates can improve the compliance for whom the yoga is intended. And measurement of intervention fidelity over time is another thing that we need to look at. And lastly, I think one of the criticisms which people say in our studies is we are not monitoring adverse effects. We might say that there are no adverse effects, but there can be minor injuries and falls, and I think we should be careful in monitoring these. So I think I'll stop here. In case there are any further questions, I'll come back.
Thank you, sir, for that overview of the entire, the problems, the status of evidence, and the way further in yoga research. I believe you have provided this entire things in the short span of 4 to 5 minutes. That's what expertise is about. Thank you for that quick overview, sir. Now, coming back to the crucial question, once again, what Manchanda sir has raised and what you have also added to this. What is the definition of yoga? That's a crucial question to be answered, because it's everyone has their own definition of yoga. So how do we have a proper definition of application of yoga in healthcare? Over to Dr. Venkatesh. Venkatesh, sir.
Yes. At the outset, yes, I would like to thank Dr. Prabhakaran. He has put forth a lot of queries regarding the implementation. For that, I feel we as a yoga and naturopathy physician, we have got the answer right now. And I would like to just summarize in the beginning how what are the challenges, difficulties, what we have faced. And in my 32 years of experience, as 24-year experience alone at government setup, and it was very, very, very tough those days. But we got the patients only with references of specialists or cardiologists or some other specialist. But when we started to open the colleges, when we started to screen the patients at the OP itself, most of these patients, please remember, more than only single-digit patients come exclusively for cardiac. But more than that, whoever comes is only for some other issues. As we all know, most commonest complaint where one visits to the doctor is either upper back pain and neck pain. So when the moment people think about yoga, they think that it is only for joints or some other movement, arthritis or something. But when we started to screen, you will be shocked, not now, even 20 years back, more than 50% of the public was suffering from either systolic pressure was very high or diastolic pressure was high. And when we say you are suffering from hypertension, it was very, very tough to make them understand that the complications of hypertension, how it is going to affect their quality of life. They have never agreed. They said, I am fine. We all know that 85% of the hypertensives are asymptomatic. And we know that it is not an isolated disease. There is something behind that. So when people normally started to come for either obesity or a high blood sugar, all this metabolic syndrome, whatever you call, so those risk factors was when we are trying to intervene with yoga and naturopathy methods to intervene their main for a complaint, they even the pressure has started to drop down. And whatever the medications they are taking, it was coming down. And if you look at it in the government setup Chennai, and majority of the patients are what you say is cerebrovascular accident. The post rehabilitation for the stroke patients have been referred by nearby premier medical college hospital. When they come for post rehabilitative care, when we started to give much result, those physicians have started to refer even for a mild and moderate cases of hypertension. When they started to refer, we started to give much result by incorporating yoga. And as there is a practical difficulty, as Dr. Prabhakar was telling, the moment we say you go for yoga practice, nobody is ready. They should how much time I should spend. What I say is it is not spending time, it is investing time. So when we say 1 hour, I don't have time. And people are so much relaxed. If at all we force, they'll just go for relaxation or a meditation call, they just lie down. And another thing, as he was telling, it should be a part of the public mass program where the importance. Basically, I feel it is the right way of breathing is the one which we should educate. Majority of the public even doesn't know how to the way of breathing. As doctor was telling, there was no proper structured yoga program or a health point of view, but in the state of Tamil Nadu, after giving these results, slowly the government of Tamil Nadu has agreed to incorporate yoga intervention at Medical College Hospital. So we have introduced with only initial at Chennai 3 Medical College Premier Hospitals. Then slowly we could develop today around 177 my yoga and naturopathy lifestyle clinics are there in the state of Tamil Nadu. And all the medical college hospital, a teaching medical college hospital is completely now equipped with a qualified yoga naturopathy physician in an outpatient basis right now. And more than that, we have got even national Ayush mission under that and national rural health mission under that we have got. So approximately last year in the month of last year June, we have published a paper saying that more than 89 lakhs 4,500 patients have entered towards this lifestyle diseases for this yoga and naturopathy intervention throughout Tamil Nadu. In 3 years, that was in 2015 to 2018. Now you can imagine the number of patients what we get through for these lifestyle diseases. And among that, the more than 50% is for hypertension. And the result is really encouraging. And we are there, sir. Our humble request to the policymakers and stalwarts like Dr. Prabhakar and Dr. Mohanan is our request to you all is to introduce in your policy that now currently even in India more than 7,000 qualified yoga and naturopathy physicians are available. They have been trained 5.5 years course under a medical university, and so there is a structured program which is available. And more than that, there is a safety of yoga, which I would like to normally, why even general patient is so scared is, as with any form of therapy, yoga can also result in, adverse events if practices are, without a qualified guidance or instructions when, given, and the extreme form of yoga is attempted, it can give even, adverse effect. And most important part of yoga practice is choosing the right form and tailoring it to the individual needs. That is what I feel, and limitation. For example, if Hatha Yoga, with certain sequences may lead to even a gastric discomfort, nausea and vomiting, which are very, very common. But when a qualified yoga naturopathy physician is intervening with that, we don't get all those things. So that should be the structured program. And asana, sir, as Dr. Prabhakar was telling, in fact, what I feel is according to yoga also, Vyadi enters through mind. So the main focus is, in fact, yoga itself is something related with the mind. It is no way connected with the physical part. Physical part, yes, it is connected, but to the very less. It is yama, niyama, then only the asana comes. So those part is the main. Now we have taken up this introduction of yoga at school levels, so that there at the school level itself, this yogic lifestyle has been when introduced, the prevention becomes very easier. So as you all agree, prevention is very cheaper, not only cheaper and wiser. That is what I feel. So again, I request the big stalwarts like you people, please introduce into your policies when you have been invited to the government policies that yoga should be incorporated in most of these lifestyle diseases, particularly in cardiac, where to help you all, we are there, sir, yoga and naturopathy physicians are around 7,000 qualified people who are registered in government are available. So I request once again to utilize us, and we have even a postgraduate MD yoga program for the past 6 years. As an academician also, I feel now, and majority of Tamil Nadu Medical College hospitals, many research has been taken, and very soon we'll be publishing few data. And I'm sure there is no time, within a short period of time, and yoga also will become one of the part of modern medicine, because if unless any system of medicine, if there is no evidence, it is not going to be called as modern medicine. It is not allopathy or that pathy or this pathy. It is evidence-based medicine. I am sure yoga is going to become a part of modern medicine with the help of you all people, sir. Thank you.
Thank you, sir. Now, over to Dr. Naveen KV for his definition of what is yoga in healthcare settings.
I think I will take from where two important points are made by both Dr. Prabhakaran and Dr. Venkateshwaran. The studies are there primarily for primary and secondary intervention, and of course now we are looking at heart failure and rehabilitation as well. So the data and the requirement and filling the gaps is one part. The large concern both in India we have problem of plenty, and so also in the West, particularly in US, problem of plenty, which Dr. Prabhakaran mentioned, that the styles of yoga, even the granting agencies are confused, and when the grant proposals are submitted, they also look for which style is being investigated. So to that extent, there is a confusion in style and diversity of yoga, and the emphasis. That's a very important component. Some of them are asana based, pranayama based, and meditation based. So this piecemeal approach, both in practice and in research, has actually delayed the implementation of yoga in healthcare. So the first thing that we should understand is that, as Dr. Manchanda put it, going by Ashtanga, it is a yoga-based lifestyle, which includes to some extent even the diet, as I mentioned in one of my slides. So for us in clinical interventions, we have to translate, and this has to be put in a document. I'm glad that again Dr. Prabhakaran has come out with a preceding study of the standardized protocol that's being used in yoga care rehabilitation study. So that has to become mandatory, and I think we will have to pool all the available data and preceding previous studies at all levels, primary, secondary, and rehabilitation, and pool these diverse yoga techniques that are researched so far and decode them. This is the word that we use, decode them, and kind of emerge a generic yoga, and I think we need to compile this and make a very critical evaluation of what is the sum total summary that we have as on today in terms of evidence, and what fits with the classical definition of yoga being a lifestyle intervention. So I think that work has to happen, and that's where yoga and naturopathy colleges, more so like Dr. Venkateshwaran said, that the postgraduate institutions with MD and PhD can work with Center for Chronic Disease. And now, thanks to Dr. Raghavendra, he is reaching out to each AIIMS and establishing Center for Mind-Body Medicine in each of the aims. So I think yoga and naturopathy colleges, particularly those with like government college where the practice and research is going on, and those with where post-graduation and doctoral programs are available, can work with these leading medical institutions, just as it has happened so far. And we'll have to come out with a very standardized yoga intervention for all levels of heart health. That's the first step, and that I think solves the problem of definition of yoga, befitting for a therapy in healthcare, and of course take away the noise that comes from these derived schools and styles from new age gurus and styles, and bring out what's called generic yoga, where it is medically compatible, accessible for research, uniform research, and therefore the data that comes henceforth becomes more cumulative and easy to translate into clinical practice.
Thank you, sir. Thank you for giving a small, crisp definition of yoga. Now over to Professor Dr. Mohanan, sir. Sir, you had two colleagues and two yoga naturopathy experts giving their definition of yoga. So how do you define yoga if it comes to cardiological practice? Sir, you are muted, sir, please.
Sorry. Maybe I will keep my definition part a little later. Let me come to the certain points that we have heard from the pundits. Now, one of our concerns, even the non-acceptance or the difficulty in accepting it was basically because of the heterogeneity. We had heard about the heterogeneity, and at one point of time, at least, it was clubbed with a religion. Now we know the acceptance is much better. It's a pure science. It has established its role in risk factor prevention. And as everybody said, was we don't need too many studies on the risk factor control, because we have, it has established a appreciable reduction of 7 to 8 millimeter systolic, 4 to 5 millimeter diastolic blood pressure reduction. Of course, the problem again here is it overlaps with the conventional lifestyle modification, whatever. See, so my wish will be to include yoga, specifically mentioning it in the lifestyle program. Every disease that we cardiologists, physicians treat, we have the non-pharmacological treatment. So include yoga in the non-pharmacological treatment. So let it be printed. I think that will make the policy makers have to do it. But then from our part, from the societal part, that is something which possibly we can do when we formulate the position statement and guidelines. See, but for that, I think we need a little more, at least some more evidences. I was listening to Naveen's, looking at some of the slides. We talked at length about the neurohormonal decrements in very many agents. I wish it's substantiated by imaging methods. Neuroimaging is coming in a big way. Professor Manjanda mentioned about cardiac imaging. We will come to in a minute. But the neuroimaging has to be done before we specifically say these are the neurohormonal changes that's happening, which has been there, which we have been talking about the last 40, 50 years. The same way, the inflammatory markers. We have few studies which showed a CRP reduction with yoga, but it is not substantiated fully. So I definitely wish more data on neuroimaging, on the inflammatory markers, especially when we talk about its importance in risk factor reduction. The second point is, again, it's coming in heart failure. It's again coming possibly a major role, because rehabilitation is an important issue in heart failure. So definitely in chronic coronary disease, and not only chronic, as Yoga Care has shown, we need again some substantial data, long-term data. Whatever we have apart from the Yoga Care, we have multiple studies. 48 patient study, 50 patient study, going into various level, 1 year intervention, then follow up for 5 years. But I don't think any substantial outcome benefit. The proof of the pudding is, eating it. So we don't need pure surrogate markers. We need hard endpoints. Yoga Care study, it showed definite improvement in the quality of life. But Prabhakar possibly omitted to say, in those who had more 10 yoga sessions, I saw the hazard, very impressive hazard ratio, almost 43% risk reduction in maybe he can say that. So when we prolong it, again the confusion Naveen mentioned, Prabhakar also mentioned a bit, how much it has to be done. Is it 6 weeks, 6 months? How many sittings in a week? No, so we have to have some specific guidelines on that. And then if it is a common guideline, I don't think the confusion is over. It's Eki Reddy, his article, every one of us are familiar with atrial fibrillation. We were talking about the dysrhythmia, the neurohormonal influences, the Takatsubo, happy, and the broken heart. So many relevance has been involved, but I sincerely wish then we can have some sort of a committee amongst all the pundits, come out with a position statement, say that these are the established facts and these are area where possibly, now if we give some sort of a position statement like that, the physician, the cardiologist definitely are going to like it and implement it. Somebody was mentioning about the paucity of reference. I do agree. See, why cardiac rehabilitation is not popular in India is not because of the heavy investment. It's because people don't realize it could save and it could create 25% mortality reduction in patients. The fact is forgotten by the physicians, us physicians. So if we can emphasize that this yoga can do it without duplication and with some sort of a specific program, I think so I look forward two things. I mean, I wish yoga to be an integral part of cardiac rehabilitation in our country, and that applies to coronary artery disease and heart failure. Because the rehabilitation in India, which is the capital of coronary artery disease, is dismal. Except I can count the numbers of cardiac rehabilitation in India in my hand. See, it is poorly established. So if we can get a cost-effective, and I am sure yoga can work out excellently well in that. That is my first wish. And my second wish will be, again, we have tons and lakhs of gymnasia in our country. We promote gymnasia. Let us also promote yoga in gymnasias. People possibly find it difficult to practice yoga at home, maybe because of the halabulla inside that. You don't have a peace of mind or a quiet atmosphere. All the gymnasiums in our, of course, COVID is another, and after COVID at least, we should insist, maybe the government can come out with a statement that we should have a separate, some of them, the multi-gym has it, I'm not disagreeing to that, but all the gyms should have a space to practice yoga. I think these are the two things that that comes into my mind, apart from the scientific data which we really want. Now coming to your last point, I think I will possibly say and quote Jiddu Krishnamurti. I have read something of the long back, and he says that yoga meaning yoke. That means joining soul and body, and that he thinks it may not be the correct definition. He thinks that yoga means harmony, skill, not only in action, but also inwardly, to have a great skill in every action. And that also applies to in our relationship. Thank you.
Thank you, sir. So you have, it was a really hearty, kind of explanation from your part on the ways forward. One is integrating, yoga in chronic artery disease management and heart failure, and the focus on the, prevention of prevention aspects, including in gyms and other places. And obviously, the quote by Dr. Mr. JK on skill, improving the skill is yoga. And improving harmony. That was really, great to hear from you. Now, going ahead, I'd like to have a, short discussion with you guys on, with the experts on, what is the current infrastructure for research in yoga? Sorry, we have one. Dr. Naveen wants to add something.
Yeah, before we really go on to the other aspects, Chandrasekhar, I think not to lose the momentum and the action item that Dr. Mohan mentioned, that it's a very heartening to listen to that. I think we should really take note and consolidate that statement that he made, that it's time now that, considering the data that's available from 80s, from elsewhere, from US, and now from Dr. Manchanda's study days to now to Dr. Prabhakaran's studies, we have sufficient data, but we need to put them together and kind of the position paper that he talked about. I think this program is sponsored by CCRYN, and CCRYN can straight away take this lead given by Dr. Mohan, saying that we can take this as an action item and create a task force led by or constituted by CCRYN, and maybe in collaboration with Cardiology Society of India, that would make it more credible, and then maybe give it 6 months or so for a consultative and whatever procedure. And then, like any other guideline, if we can be able to publish a current status of evidence, intervention standards, and possible implementation, I think that would be a great lead, as Doctor said, to all the practicing cardiologists and the hospitals. I think that's the good starting point for our integrative cardiology practice. I just wanted to cement that thought that he proposed. It's a very important thought. I think I just wanted to cement it, and thank you.
Yeah. Could I just intervene for a minute only? The definition of yoga is not clear. Can I say, Dr. Chandrasekhar?
Yep, please go ahead, sir.
Yeah, you think when I started my research in yoga, my patient said, "Doctor, it's very difficult to do yoga because they are very complicated asanas." And I would still suggest, then I had to tell them that it's not really asanas and all, it's a complete way of life and all. People who have osteoarthritis, they will not like to do it because they saw the photographs and all. We started a chair yoga and all, and we told them it's very easy to do it. There are 3 components of yoga, you see, which can be easily done by anybody of any physical condition. Physical exercise cannot be, and that's the advantage in heart failure. Many patients cannot do exercise, but they can still do yoga. There are several studies, and there are 3 components. One is the stretching exercises called asanas and all, and there are benefits shown by this doctor, I think from Harvard, that number of stretching can improve. Then there are breathing. Breathing means you have to take more oxygen inside. We use 40% of the lungs and all. And the third is that we have to do meditation. So these are 3 components. Everybody can do breathing and the meditation. It's not difficult. So I would suggest one thing. You see, as I said, it's a complete lifestyle, the best lifestyle. We always say that change your lifestyle. I call it a yogic lifestyle. It's the same lifestyle which Dr. Mohan said. We tell our patients that change your diet, do exercise, don't do stress. But this yoga tells you how to control stress. My patients come and tell me, "Doctor, you said don't do stress, but I don't know how to avoid that." So I think yoga is a method of doing it. Secondly, I would like to tell that, yes, the only way to introduce this in the hospital is to have an integrative center or a yoga lifestyle clinic. I have in Gangaram Hospital, we don't have a place at all. In one room, we have one yoga teacher, and who is teaching yoga, that patients are being referred by the doctors and all that thing. Thirdly, I would say that how to make it popular, that doctors themselves should do it. You see, being a teacher, I have taught many of these students, and once they find the benefit, they tell our patient. The only way that the patient will do it, I am doing it regularly for the last 25 years. All my cardiac patients do this. I say, do yoga, change your diet, exercise, etc. Then they say, "Doctor, it's very difficult to do." I tell them, take a deep breath, and that's yoga already. So we tell them very simple methods. If you have in the hospital, so integrative cardiology is the answer these days. And there are a lot of studies to show that integrated medicine has much beneficial effects. It's cost effective. It is helpful to the doctors as well as to the patients. They can be discharged early. And the depression and anxiety, which is associated with most of the cardiac diseases, which have a very high prognosis, very high mortality. For example, after a bypass, if you have depression, the mortality is increased after angioplasty also. And I think yoga should be told to all the cardiac patients, irrespective of cardiac rehabilitation, whether before going to surgery, after surgery, in heart failure, not in heart failure. At least it can take care of depression, etc., which may decrease mortality. We know depression increases mortality by 25 to 30% in all cardiac conditions. So I think it should be done, and the only way is that the doctors should insist that to find out whether they're doing it. When my patients come to me, I always ask them, did you change your diet? First question is, did you do your yoga and all that? And I think if you ask repeatedly, these at least in secondary prevention, it could be very helpful. And it will be, and then they ask, how long should I do? Initially, as I said, half an hour or so. Later on, I tell them that it becomes an attitude. It has to be done 24 hours. After all, what is yoga? If you're sitting straight, that is yoga. That's posture. If you're breathing properly, not breathing fast, slowly, that is yoga. And if you're thinking properly, that is yoga. So I said, ultimately, it is your attitude which has to change, because the stress can come anytime for any condition and all. If your attitude, mind attitude is changed, you will see that you can face the stress of any time. It's not that 1 hour is important, but doing that 1 hour initially can slowly change your whole attitude. The whole idea of yoga is to change your attitude, and this does happen. So it is a 24 hours practice. I say while eating you can do yoga, while walking you can do yoga. Full concentration with awareness. Mindfulness is yoga, nothing else. So if they are mindfulness of whatever they are doing, ultimately it is a 24/7 practice. See, while sleeping you have to do yoga. That is yoga. So I tell them that initially you have to start it, but ultimately your attitude will change completely, and you will become a yogic thinking personality. Sitting straight, breathing properly, and thinking properly is yoga.
Thank you.
Sorry for this.
Yes. Thank you for your wonderful definition of eating right, sitting straight, and thinking right. Thank you. Now we will go to the important question of infrastructure to conduct research in yoga, and how do we go about it in terms of human manpower, human resources, or the support for kind of monetary support in terms of granting aid programs in the country. Now this question, please, Professor Prabhakaran sir. So I think you are muted.
Sorry, I was saying that I got cut off. I don't know what happened, but I missed most of the conversation. In terms of how do we promote research in yoga? How do we create the infrastructure? These are two very important questions. In terms of promoting research in yoga, I think we have to inculcate the principle of multidisciplinarity. It's not one person's domain or one discipline's domain. It requires multiple disciplines. The second thing is, I think this has to come from the time of undergraduate training itself, inculcating this sense of critical thinking and research. And therefore, I think in the yoga curriculum, the yoga naturopathy curriculum, we should have a training program on research, critical thinking, because unfortunately what has happened in our own country in India is that we have been trained to think we're given a certain set of facts and we just rely on those facts. We don't critically analyze those facts, and that's ingrained into our philosophy. I think that has to change. We need to provide that critical thinking, as well as we need to provide the training in terms of research. The other thing is the government organizations, Ayush in particular, Department of Biotechnology, Department of Science and Technology, ICMR, they all need to plan out and create task forces. I mean, you can conduct first a kind of priority setting workshop and prioritize what are the areas of research that is required in yoga. I mean, it can be as small as understanding the mechanism or identifying the outcomes, or even in terms of scale up implementation science, how can we do it? What are the populations where it has to reach? Are there underserved populations where it can benefit the most? So there are lots of questions that can be asked. Identify those prioritized research questions. In terms of infrastructure, create these centers of excellence, which will do end-to-end research, plus advocacy, plus policy translation. So it has to be a holistic package that comprises of researchers, policy translators, and advocates for the program, including health promotion. I think we need to create that. So we require high quality research, not small studies, not studies which are meaningless, not studies which actually self-fulfilling. We say that, oh, it works and we have done the research and it works. We actually need to do it in a very scientific manner. And yoga is one of the easiest thing in the Ayush system to conduct research on, because yoga doesn't rely on the 3 different types of the body, things like Vata, Pitta, and all that. It can be done by anybody. So in that sense, it's a good place to start research. Over to you, Chandrasekhar.
Thank you, sir. Thank you, sir. That was a really thoughtful suggestion on priority setting workshop, improving infrastructure. Now over to Dr. Venkateswaran, sir. Your idea on what is the actual status of infrastructure for research in yoga and naturopathy, and how we can upscale it.
Now, recently, government of Tamil Nadu it's opened the International Institute of Yoga and Naturopathy Medical Sciences at Chengalpattu, and we just started only for OP, and which is closely attached to the Government Medical College of Chengalpattu. And there is a postgraduate program also with the intake of 10 PGs per year. And what I want is, whatever in our yoga naturopathy curriculum, as Professor was rightly telling, the research methodology has to be included in our UG syllabus itself. So as I remember Dr. Naveen was telling long back, the syllabus in the whole India level, it has to be restructured, which is very, very old. And so once the research has been introduced in the UG level, at least in the final year, during the internship itself, the students start doing it. And this can give you a major step for producing more evidences. And then it is easy for when they come to the PG level, it becomes very, very easy. And now there are many yoga naturopathy lifestyle clinics or even yoga naturopathy hospitals. The patients are readily now available with the help of stalwarts like Cardiology Society of India and all these professors. So we need their help. So if the peoples like Dr. Prabhakar and Dr. Mohanan, if we could guide us and framing research activities and everything. As for the human resource is concerned, I feel now we are readily available. And it is available. As far as Tamil Nadu is concerned, we have very recently, government has sanctioned state-of-the-art research lab also at Chennai. And we are ready to help you sir at any, whatever the services you require from human resource from the city of Chennai. So the same thing can happen in each state now.
Thank you, sir. Over to Mohan, sir. Sir, how can we inspire the cardiological society to conduct more and more research in yoga and to understand the mechanisms and the effectiveness studies at large?
I was touching on that in my earlier this thing also. Now, it's a pity that I don't know whether it's a correct, Prabhakar, but I read somewhere that the 38% of yoga research happen in United States, while in India it's 27%, the birthplace of India. So I think we absolutely need, this applies to even the yoga practicing population. While the prediction is that about 50 million people in the United States practice yoga, I don't know exactly. I read somewhere it's about 11% of Indian population who practices yoga. So I think we can have a two-frontal attack on. One is how to generate more evidences, and the best way, I suppose, possibly is as the continuation of the program that Prabhakar has done in the yoga care part, the follow-up part, and the sub-analysis, which again give us. It is not the quality of the life improvement alone that you have shown. In those who systematically do it in a more number of time at a larger number of days, we can possibly show MACE reduction and every, you name any statistical points, I think we can have that. So we need, of course, only problem is we need a more larger number to show all these statistical figures. So definitely in areas of chronic heart disease, chronic coronary artery disease and heart failure is the one. And as we were, all of us were in joining in one proposal that the yoga's place possibly is best suitable in cardiac rehabilitation. So if we can concentrate and convince both the policymaker and the clinician that yoga is the best way of cardiac rehabilitation, then I think is the best. That will be a success story, Prabhakar.
Right.
That's that was really motivating, sir. Now we'll go to the next important theme of the clinical implications, whatever we have found. Dr. Mohan sir has beautifully put that, for the acute myocardial infarction and, that's chronic, artery disease, along with the heart failure patients, yoga is already to be upscaled. So we have, sufficient evidence to say that it improves, patient outcomes. So how we can do this in clinical practice, like out of 100 cardiologists, so the self-interested cardiologists are advocating this. So how we can ensure that all the patients in this category get this yoga intervention per se. Sir, over to Mohan sir once again.
See, I mean, basically, I think we should promote whatever, as all of us agreed. There is a lack of a consensus on the importance of yoga as a part of in whichever, whether it is the primary risk factors, the primary prevention of risk factors, or in secondary prevention. So the best policy will to compile whatever the scientific data available, go through the data, and then come out with a position statement that these are established values in these areas. And here I think the chronic coronary artery disease comes in as the number one. There is no lack of meta-analysis. But then I don't think there is any single compendium on yoga and its effectiveness for the steady perusal for the clinician or the cardiologist. So if the group here, or of course we can involve as many number of pundits, no problems on that, can decide on them coming out with some position statement on the utility of yoga in day-to-day clinical practice, I think that will come in a longer way to popularize it amongst the clinician. That's my belief. I could be wrong.
That was a great suggestion, sir. Like, maybe from CCRYN side, they should take a lead, or from CCDC side, we will try to take a lead on having that kind of a consensus development program very shortly. Now over to Professor Prabhakaran on the same question. Like, sir, we have evidence now on certain conditions. How we can upscale this evidence in the current context?
Right. I mean, scaling up is, one thing is to show that something works. Scaling up will naturally happen if we show robust evidence. Unfortunately, for our yoga care rehabilitation, we just showed improvement in quality of life. We also showed that if people who practice yoga actually have a reduction in mortality, but by going by scientific principles, that would be biased. So we are awaiting the follow-up of these patients, and once we get, then you can easily scale it up. I think we have been trying to disseminate. Unfortunately, what happened was this trial got published at the height of the pandemic, when everybody was focused on COVID. And so maybe when we do our next iteration in terms of the long-term follow-up, I think it'll attract attention. And,
thank you, sir. Now, over to the another important area. Why there is a need for qualified professionals in yoga research? Now, I want to like this. I'd like to ask this question to Dr. Manchanda. Yes, you are having almost 30 years of experience in yoga research. How do you, rate the need for qualified professionals in yoga research?
Yeah, I think there is a need, because many times they clash with the modern medicine. For example, suppose I send a patient for, say, he's a coronary artery disease for yoga and all. That if the person is not very well qualified, and the type of diet they are told is many times completely different and all. And because they do not understand, you see, if a person has to be trained in, for example, cardiac patients and all, we have to give them some sort of training sessions also, what is cardiac disease and what is good and what is bad and all. And sometimes they tell them asanas which are really not very good for that condition at all. For example, if a patient has heart failure, he should not bow down his sort of face below the legs and all that thing, because the fluids will change and so on and so forth. So I think qualified people are needed. Not only that, if they want to work in some specialty areas like cardiology, we have one working in cardiology, and I had several people who were working in that center for the last 25 years. I think slowly by interacting with me, they can interact with the doctors. They understand what heart disease is, what is good and what is bad for these patients, what type of diet has been scientifically validated. So they change accordingly. The diet is not very much different, but sometimes they emphasize on certain things and all, and they understand what is good and bad for these cardiac patients and all. So I think there is a need for qualified people, and not only qualified in general, but if they are going to do specialty areas, then they need some training in that area also.
Yeah. Thank you, sir. Sir, with your experience in yoga research, in multicentric trials, how do you see this, need for qualified manpower in yoga research, sir? Prabhakaran, sir.
Sorry?
So how do you see the need for qualified, professionals in yoga for conducting quality research as a person who conducted a multicentric trial in yoga?
Right. I think qualified people from yoga and naturopathy are extremely useful because I think they have the knowledge, background knowledge of the anatomy and physiology of the body. B, they are well trained in yoga and they're not wedded to a particular agenda or particular philosophy. So they have open thinking about yoga. The third is if you add a research training component to whatever they have been trained, I think they're excellent candidates for carrying out yoga-based research.
Yes. Thank you, sir. Now, over to Mohan, sir. Now we have several quality improvement programs, incorporating, some new component like, like educators or other professionals in the healthcare system for primary prevention and also, prevention of hypertension, diabetes management programs. How do you think that this yoga naturopathy fraternity can suit those population?
I was really surprised to learn from Professor Venkat about there are 7,000 qualified yoga people in India, because when we approached for the yoga care to get a qualified person, now we found it difficult because now, so I think there has to be qualification set for this, and now I learned right now that we have no confusion in that. We have enough and more people. But then in all the quality improvement program, this could be one of the aims of it. See, something like, now we have a popular phrase called cardio exercise. See, let us coin a term like cardio yoga and come out with, people should come out with, what do you mean? We have now specific items for cardio exercise. What is cardio exercise? We have definition and we have standard set of exercise program. So in the same vein, if we can formulate what is cardio yoga, and if the experts can set aside, it may be difficult. I don't know. I honestly don't know. But if you coin terms like that, that stick with the people. It is easy to translate this into not only doctors, but even to our patients. Now, we always talk to our patient, you do cardio exercise. In the same way, I can talk to my patient, you cardio yoga. So definitely in the programs of quality improvement, especially now we were about to begin. Prabhakar will definitely in the heart failure quality improvement program. This is something which we can definitely include now. Once we have a more structured systems, the system has to be structured, simple, as everybody said.
Thank you, sir. Now over to STV, sir. Now we have almost some 250 major yoga naturopathic hospitals, and more than 500 with more than 30 bed hospitals in the country with the yoga naturopathy hospital beds, and most of these beds are commonly filled with two group of patients. One is people with pain and people with cardiometabolic diseases. So cardiometabolic diseases are one major group of people visiting yoga naturopathic hospitals. Now, given this, how we can take evidence from those settings, because the earliest clinical trials of, whether it's a DNRN study or even Manchandasa study, we had a patient clinic, like, they took a hotel and where they, put the patients for 10 days and, gave the initial stronger lifestyle intervention program. And even in Manchandasa program, we had that, yoga ashram where the patients were sent to learn yoga for a week. And then they went to home for, they had 14 days of residential practice followed by home practice. So similarly, we can think of incorporating evidences from these yoga naturopathic hospitals. How we can take these evidences into, the conventional area. Over to Venkateshwaran, sir.
Yeah. Yes, I strongly agree with Dr. Mohan sir. As he said, what people want to see, I say, for example, a particular A pranayama is very good. Then other school of A say, no, it is B is good. And the name itself differs. So even a referring cardiologist, they get confused. And now only even Dr. Mohan was coming to know that there are enough of availability hands in the field of yoga and naturopathy. In fact, in Tamil Nadu, within 2 years, almost I think 18 private medical colleges have mushroomed. And the demand, and even Dr. Machananda was saying that the doctors themselves should practice. In fact, the Tamil Nadu government super specialty hospital at Chennai has given us a more than 3,000 square feet of area exclusively for yoga. And more than the patients who was coming there, the doctors, the surgeons who are going through a lot of stress, they started to come to our department just to relax. But when they go through this relaxation, whatever the crowd will be waiting to see that particular cardiologist, they will first send to the yoga department, go and get your stress reduced, then come out. Till now, even I'm very sure no one comes straight to yoga because they think it is very tedious procedure. That 1 hour we have to spend. It is easy to pop up a pill or it is easy to pop up a drink or something. So as somebody was telling, it is a yoga. Even I feel we should make it into a tailored program like cardiac for respiratory. For that, we need a high-level committee at government level, at CCRYN level. So I request the CCRYN to frame a high-level committee inclusive of cardiologists and some yoga naturopathy physicians and formulators. This is what, including for cardiac rehabilitation or cardiac primordial prevention or primary or secondary. These are only thing. Among this only we should. Then it can be easily incorporated to the syllabus, and easily there will be a uniform methodology like a pharmacology. Otherwise, each school of yoga will have a different thing, and no single patient will have only a particular type of cardiac ailment. He will have some other comorbidities, like he may have some other issues with even a spine or something. So as Dr. Machananda was telling, yoga is, as people was telling, they are thinking that it is only asana of asanas. I feel it is like a mustard size. More than that, it is basically it is the other side of the coin. I mean, this is the thing. So when we are able to focus for them the attitude, that in fact stress is nothing but an attitude. A right attitude is yoga. So when they come, we should educate the patient that yoga is not at all an asana, whichever the pose, if now all are in yoga, in fact, whether whatever the pose you are sitting, if you are able to sit in a relaxed manner for a longer duration, then it is easy to regulate the breath. If you are able to regulate the breath, it is easy to concentrate. If you are able to concentrate, then it takes to the higher level. So what we need is no patients doesn't have a patient. Doctor, we ourselves don't have a patients. So I feel yoga is everyone. As Dr. Machananda was telling, we ourselves should practice. So it doesn't mean we need long time to practice. At least we should start focusing on breathing. I request this cardiologist to put it in their prescription as instead of writing a mini with a tablet. The first thing is like stressing on lifestyle. I mean yoga. Just start learning a correct way of breathing. That breathing alone can change wonders with their mind. So that becomes easier. So with the availability hands right now in throughout India, I think the cardiology society, whatever they require, I think we'll be able to support them. And I request the CCRYN to design, to make a tailor made cardiac yoga in 3 components, and then it is easily incorporated. And most of these hospitals now, we have our own diet, in-house program with the individual room and everything. In fact, in government of Tamil Nadu, it is A to Z, it is free, including the room, in special room. And the diet is given is purely pure vegetarian diet. So the patient doesn't have any way to have something else. So we can do a long study, in a larger study, even for a long duration. That is what I would like to put forth to Dr. Prabhakar and Mohanan, that we are there, sir, even for do a longest duration study, and we are there, and we could even bring down the weight of 50 kgs and over the period. But the question is, the sustaining the weight loss that is what people normally do. But when the lifestyle is given the correction, when we started to educate the patient, when the cardiologist reduce the medicine, now people have started to come to our hospitals. In fact, highly qualified, pivotal position officers started to come. Plenty of modern medicine practitioners, they started to come for our regular yoga classes, and it is not in one sitting where one can learn yoga. So over the period, when they have been given a tailor-made program, and it is easy for them to implement, when they start to implement, I am sure it will give a wonderful result in a longer run, and no doubt in it. With the help of Cardiology Society of India, with the help of available yoga and naturopathy in-house hospital, and even outpatient facilities, we'll be able to produce it in a short period of time, sir.
Thank you, sir. The same question to Professor Prabhakaran, sir. So there are almost 500 hospitals with 12,000 beds in the country, and most of these beds are occupied with cardiac population in any given point of time. They form the highest proportion of people visiting yoga naturopathy hospitals. How we can infer how we can make use of this cardiac the population visiting this, and translate them into evidence using registry models or cohorts. How we can think about that, sir?
So I think somebody has to take a lead, and you can look at a cohort of patients with established coronary artery disease, or patients with established hypertension or diabetes, and look at people who follow the yoga lifestyle package versus those who do not, and make a comparison. That's one way of doing it. The other way is to embed small interventions there. I mean, it all depends on what resources you have. You read, even registries and cohorts need resources. So that should be provided by someone. Ayush can take a lead in providing those resources. And there are simple ways of collecting data nowadays. We do have electronic data collection, which is freely available, open source, like RedCap and others. So it's doable. It's not that it's not doable, but I think there has to be a will, and there has to somebody who has to provide time for doing it. So Chandrasekharan, now I have to leave because I've got another call here.
Yes, sir. Now, thank you for your entire time for the session. Now, concluding remarks from each and every panelist. So, starting with Professor Dr. Mohanan, sir. Your concluding remarks, Mohanan, sir.
I think we had. I have learned quite a lot of lessons today, and in all my whatever discourses I made, I was concentrating on two things. One, we should popularize this among the clinician, and the best way is to give them a module. I mean, we have now smoking cessation module or exercise module. In the same way, we should design some yoga module for the cardiac patient. You name it, whatever. But I will prefer cardio, like cardio exercise, cardio yoga, and make it simple, easy to follow, and of course, and with the help from the accredited, if we have accredited persons to practice that, excellent. Even otherwise, it may be now is the time of all the remote things happening. So this is the best time to start every educational program remotely, not physically. So I think we should, you are with large groups of people, with your association, we can definitely try to implement it. Then also importantly, make yoga as a part of rehabilitation. Make every effort to make it part of the cardiac rehabilitation program. That is the easiest way to popularize yoga. Thank you.
Thank you, sir. Prabharan sir, your concluding remarks.
So I think Chandrasekharan and Dr. Raghavendra Rao, you made a good start. The start in terms of getting different streams of people coming together and discussing threadbare as to how yoga can be useful in several of the diseases that we encounter every day. But I think let's take, instead of being too ambitious and trying to do too many things, let's start small. And let's say that we focus on few areas and try and implement the yoga program. As you rightly said, that the Ayush hospitals are a good place to start. And let us look at ways and means of introducing yoga and popularizing them in the Ayush hospitals and take it from there. Meanwhile, we'll continue to do research, we'll create the evidence and look at how to improve the evidence. Maybe the Cardiology Society of India, because Dr. Mohan is the president, I can ask him that there should be a session on academic session on yoga and cardiovascular health every year in the CSI conference, where we can get a multidisciplinary group of people to discuss things and introduce some of these concepts there, where cardiologists actually can participate in many of the studies that can come out of this discussions. Thank you.
Thank you very much, sir. Now over to Dr. Venkateshwaran sir, your concluding remarks.
Yes, sir. The same thing, whatever Dr. Mohan and Dr. Prabharan was telling, and that has to be implemented. Like every year he was telling, even like Cardiology Society of a conference. Recently, 2 years back, there was a cardio-physio conference at MMC at Chennai. And they have invited, I was there, and most of this such conference has to be every year has to be conducted, where there should be integration of importance of yoga, so that it goes to knowledge of almost all the cardiologists, the importance of regular yoga practices. And again and again, my request is, again, we should make a task force or something at a national level and design a capsule, and then to implement it. Yes, as Dr. Prabharan was telling, there are plenty of right now yoga naturopathy hospitals are there, and those centers can be utilized with a funding agency from CCRYN.
Thank you, sir. Over to Professor Manchanda sir. Sir, your concluding remarks, please.
Well, I must firstly congratulate that you have started this dialogue between the so-called the allopaths and the other systems of medicine. It's really the age has come, integrative medicine. As you just heard, that patients do not go directly to these centers, and it is through the allopathic doctors they go. Mostly 90%, I would say, go through that. So I think the awareness among the doctors have to increase among the allopathic. The awareness is not there. I think we have a lot of evidence, and I have given so many talks, and still the awareness has to increase, and that can increase. I think in the undergraduate also we have to keep some yogic lectures there in the postgraduate also, and make it more or less optional to do yoga even in the undergrad, because once they find it is useful, it could be. And thirdly, as Dr. Prabhakar said, I think some modules, certain research has to be carried out, which he has done, like in rehabilitation, and say it is available in these hospitals. For example, there are naturopathic hospital and all. This module that we have found out is useful there. People will go straight there, because this is a module which has been developed on scientific basis and all. And I think this way it will become very popular. But I would still say the time has come that we have to integrate the best of the ancient wisdom and the modern medicine. That's the only way the science will progress, because the future is really of mind-body medicine. I think we have been saturated with our type of medicine, and we have to include some others. And to do that, we have to live in harmony. Sometimes I have found a lot of opposite views of the so-called the modern system and the other systems and all. We have to live in harmony. We have to give and take. That's the only way I think we can progress.
Thank you very much, sir. Thank you all the experts for this wonderful deliberations, and this is a first ever the Kraspati deliberations. between modern medical practitioners and yoga naturopathy physicians on a topic very relevant in the Indian context. I thank all the experts for your full half-day presence here. Thank you once again. Now over to the organizers.
Thank you very much for all the distinguished panelists for here. Of course, we know that it's very difficult and it's very hard for us to collect all these extinguished panelists to spare half a day with us here. I know all of you are very busy practitioners and busy researchers, and finding even a 10 minutes of free time is very difficult. But with our request, you have agreed to participate, and we are very happy to have this deliberation on yoga for heart health webinar discussion. As we have discussed so many things today in today's panel discussion. We also heard how it was difficult to introduce yoga in earlier 1990s when Professor Dr. Manchanda started the research study on yoga, and the way we have moved till now. So with these difficult times where it was very difficult to accept the word yoga, and now we have moved and showed that yes, yoga can be accepted. So the time is very short. In future, yes, definitely we will come out with a definitive recommendation where yoga is a probably integrative intervention in the management of cardiac diseases. As yes, we heard from all of you today that yes, we have certain shortfalls. Like there's a consultative meeting needs to be convened at the earlier stage where we can collate all this evidence generated on the studies conducted all over the world and put it into a position paper and publish it and then present it to the Cardiological Society of India as Professor Dr. P.P. Mohan suggested, and it would be the best way to take it forward. And in that way, the CCRYN, being an apex body in the field of yoga and naturopathy research, definitely will take it up this one by having experts, eminent experts, both from cardiology field as well as the yoga field. And soon we will convene the meeting and to come out with a good position paper and a standard guidelines for the practitioners, and also to develop a small modules where we can train our BNYS graduates in this cardiac research as well as cardiac clinical practice, how it can be easily incorporated in clinical practice. And I once again, on behalf of our director, Dr. Raghavendra Rao and CCRYN, Ministry of Ayush, I once again thank from the bottom of my heart to all the extinguished panelists, Padma Shri, Professor Dr. S.C. Manchanda sir, Professor Dr. D. Prabhakaran sir, Professor Dr. P.P. Mohanan sir, Professor Dr. S.T. Venkateshwaran sir, and Professor Dr. Naveen K.V. And at the last, my own friend, Dr. Chandrasekharan, who has taken much effort in contacting all of these extinguished panelists, put together and bring them on this platform and making it a successful webinar. Thank you very much. And we hope to have your continuous assistance and guidance in future too. Thank you very much. Thank you, one and all, sir.
Okay. Thank you.
Thank you.
Thank you.